reassuring the parent that what they can control, or our nutritionist said, and I think you had brought this up, like with especially with some of the points that Sadaf meant as well, made as well about the stigma, and with the fact that Bill said that the most folks who are bringing the most stigma sometimes into the room are the healthcare providers, is kind of having that conversation, first of all, about talking to them about health behaviors, as we said, but also talking to them about what it is they can kind of control, and talking about what they can provide as opposed to what they are going to deprive. So what a parent can control, our nutritionists always talk about in our weight management program, is a parent can control what food is served, when the food is served, and how the food is served. But what they really are looking for is asking the children to decide how much and whether or not they eat it. And the way you can promote healthfulness is promoting changes in food choices, and doing, as Steve had said, as a family, to take on for the month of March, we're going to try a new green vegetable at dinner today, and at dinner every day. And we can choose who's going to choose that vegetable, but everyone has to at least have one. I always talk about no thank you bite. So even if they don't want another one, they all have to have that bite, and they all have to allow it to be on their plate. So small changes like that. And I think it's very important, especially with the pandemic, parents have been much more open to this, for them to become much more vulnerable to the changes they can make too. And how, again, as a family, we can start to make a deal to, along with doing, a movie night once a month, once a week, we're going to start to try an activity together, start to try a gardening activity together. So there's lots of things in that, using that same pandemic, we're in this together. There is a lot that families can kind of start to center their own kind of healthful journey.